Hi there, and thank you for joining Change I Am Possible, India's first future tech podcast. Do kindly subscribe, support, and share. So, technology is growing exponentially and is transforming mankind. We're pushing the boundaries of what we once termed impossible, leveraging science and technologies. So, I spoke with Patrick Ganzer. He's the principal neurotechnology research scientist and bioelectronic medicine lead at the Battelle Memorial Institute, the world's largest non-profit research organization. So Patrick and his team have built a brain-computer interface which has restored the sense of touch and movement to a paralyzed man. These technical advancements could not just strengthen the understanding of our brains, but also be a ray of hope for those millions of people around the world who are suffering from debilitating neurological disorders. I wish you enjoyed this conversation. So Patrick, you know what? I'm going to start with your founder, Gordon Battelle. He was the founder of Battelle Steel, and his last will was super inspiring, and it connected with me. And to the audience who don't know about it, I want to read out the last will because Change Transform India, the podcast, shares the ethos, right? So his will read: translate scientific discovery and technology advances into societal benefits. Education, encouragement of creative and research work in the making of discoveries and inventions to do the greatest good of humanity. How cool is that? We need more people who share that vision of shaping the future of this world, right? So can you share a little brief on Battelle before we get into it?
Sure. So Battelle Memorial Institute is located in Columbus, Ohio. It's its main headquarters in the United States. It's been around for 90 years. And so we are focused on a number of different technology and research thrusts that are spread across a whole domain of, or many domains of science, ranging from physics to cybersecurity to chemistry, biotech, and I work in the medical devices group. So along the way, in the 90 years of existence, Battelle has helped invent many common technologies that are all around the world, ranging from the Xerox machine to cruise control, the CD-ROM, the barcode, and one of the most recent exciting technologies that we've been working on is a brain-computer interface to help a once paralyzed individual move their hand again and also feel from their hand. So that's
Right, right.
an overture of Battelle.
Lovely. How cool is that? So you are part of the NeuroLife program at Battelle, right? So can you share a little bit the details about that, please?
Sure. So across all the domains with devices, the is where NeuroLife group sits. So we're a group of statisticians, electrical engineers, and I myself am more of a neuroscientist or a neuroengineer. And so we work on a number of neural interface technologies. So what that means is building a device that can either record and or stimulate the nervous system to treat disease. So we've mainly been on a brain-computer interface to do that. And along the way, we've developed a number of other medical devices that can interface with the body. We use artificial intelligence to decode what's happening in the muscles or in the brain or in nerves, and then activate a device to have a therapeutic effect. Someone can move their hand again or ameliorate some other part of the disease.
Right. So Patrick, so people who don't know about brain-computer interface, can you just break it down, explain in layman's term what brain-computer interface and what's going to do?
Sure, good question. So at a very high level, there are three components of a brain-computer interface. Number one, you of course have to interface with the brain to record the electrical activity in the brain. This can be done non-invasively, so without surgery, or it can be done surgically. So you can get closer to the brain or go inside of the brain and listen to the brain waves. The second component of a brain-computer interface is, okay, I'm listening to the brain, but it's very complicated code, right? So I need to understand what a certain set of brain waves represents in terms of a thought. Let's just say I want to move my hand, I want to open my hand. That set of brain waves might look much different than if I want to close my hand or something else. And so the third component of a brain-computer interface is I'm recording, I'm decoding thoughts, and then I need to do something with it to help the patient or individual. And so in that case, you can activate devices with brain-computer interfaces like control a computer cursor, type out an email for individuals that unfortunately can't do that because of the disease. And in our case, we utilize the thoughts of a paralyzed individual to help move his hand again by stimulating muscles in his arm to make his hand move. So those are kind of the three buckets of a
Right,
brain-computer
right,
interface.
right, right. So tell me, I mean, there's not much research done when it comes to of brains, right? I mean, that is something which is still, we still haven't figured out, right? We've got 80 billion neurons, we've got 100 trillion synapses and those dendrites and what they do, God knows, right? So there are a lot of these people who are trying to figure out what's happening over there because, there's this Elon Musk who's trying to figure out with NeuralLink, there's Brian Johnson who's trying to figure out with Kernel, there's Facebook doing his own thing. Then there are these individual scientists like Ed Boyden and Mary Lou Gibson, so many others who are just trying to figure out what is happening in a brain, right? So yes, I mean, tell me how simple or easy it is to capture or cognitive structure, and where are we in the terms of technology now? Neuralink, Elon Musk says that we can actually capture somewhere around a million neurons firing. Now, how far are you with your capturing your neuronal data?
Right. So specifically in our brain-computer interface, which we work with a company called BlackRock Microsystems. So they have one of the only actual chips that can go into a human brain for recording. As you mentioned, there are new efforts that are mainly in the preclinical domain, where you're increasing channel counts, right? More neurons, more cells. We currently have about 100 little, almost microphones, where we're listening to the brain, and the chip is very small. It's about 4 by 4 millimeters. Um, Even with that small patch of brain, right? It's maybe the size of a pea. This chip, we can record different thoughts related to 10, 15 different movements. And to answer your question about how far are we along with understanding the brain, I think one of the interesting parts of a brain computer interface is if we listen to the brain and we can decode the patterns, we don't actually have to know how they emerge, right? From a scientific point of view. We don't have to know it's this cell doing this and this was the gene or protein. It becomes information. And once you can get information out of the brain reliably, it still is a black box. So a lot of scientists do to study how the brain works, how does it generate this? But on the other end, if you're trying to use the brain and help a patient in a device, you can still get quality information out without really having to understand exactly how it's generated. So all of these devices that we use, like a car or a microwave, they're quite complex. We don't have to know exactly what's going on with every wire and so forth. So brain computer interfaces have that beauty where you don't have to understand all of the base kind of neural dynamics. And that's where the field's at right now. There's a lot of work to do, as you mentioned. It's a lifetime of different studies to occur
So
so far.
what are you saying is that your devices capture the data, it captures the information, it doesn't necessarily know what those firing and wiring is doing. Is that what you're getting at?
That's one angle to study the brain. You don't have to do it that way, but that is how we are approaching it, and many other brain computer interfaces are approaching it.
Right, and you said you have a chip size, the size of a pea, right? So what exactly it does? What are its capabilities? What are the information that it can grab? Like, I mean, everybody knows we've got five senses, right? So does it capture, what information does it capture, and what is the future of the chip? Where do you see it go?
Right. So our specific utility for our brain computer interface has been to restore movement, paralyzed hand. The participant in these studies, Ian Burkhart, unfortunately has a very severe spinal cord injury. He had this, unfortunately, when he was diving. And following that, he now has paralysis in his hand. So he cannot move his hand, he cannot move his wrist. And we can think of how devastating that is to your quality of life. He could still move his shoulder and his elbow. So we use the brain computer interface to listen to his thoughts about hand movement. He's trained his brain to generate these. We've trained a computer to detect what he's thinking. So if he wants to open his hand or close his hand, that looks different in the brain. And then we stimulate his arm to make his hand move so that he can pick up objects. He can play Guitar Hero. He could swipe a credit card. So he goes from complete hand paralysis to having different functional grips so that he can use his hand again. This is really exciting. That is related to the movement side of our work. So there's also the most recent findings from our group are related to the sense of touch. So it's nice to move again, but one of the big deficits that Ian's had is even though he can pick up objects and he can do a lot of great things, even though he has a severe injury, he's doing that with a hand that he can hardly feel. So that's kind of where we've taken off the most recent work. And to answer your question, what else is in the brain? We have been focused on movement. Now we're looking at touch and movement restoration. And that's the recent work that's been published by the group.
Right. So, as a neuroscientist, does it bother you that we know so little of the brain? And what do you think should be done in that sector or research where we will get to know more about the brain and then more people will be able to help with it? So, what do you think we should be doing, or the entire community should be doing?
Yeah, so it depends on the application. If we were, so Battelle is focused on constructing devices, developing new technology to help people. And we do look at the science of the brain and look at how these things occur. Does it bother me that we know so little? I think it's very exciting. I would, if we knew too little, then I wouldn't have a job for much longer. So, but there it really is so much more work to do, which is really exciting and intimidating at the same time. Um, I think that yeah, biomedical engineering, neuroengineering are super bright fields for the future. Uh, to get more people involved in it, I think awareness is great. Obviously, that's part of what we're doing now to get the word out about this technology. Um, One of the most exciting things, even though we know so little, is that we can do a lot to benefit patients. Interfaces, for example, there's been a lot of great work um, looking at restoring locomotion in individuals that can't move their legs because of a spinal cord injury. We could talk about epilepsy, Alzheimer's, deep brain stimulation for Parkinson's is another one. So in my field, we do investigate neuroscience for neuroscience's sake, but it's exciting even though we don't know exactly how things work. We can still interface with it and make things better for people, which is really cool.
Right. So tell me about your research subject, Ian Burkhart. I mean, when did you take him? What was the problem? You said obviously he is a quadriplegic patient, right? And he can't. So from the time you guys took him till now, what has been the progress? And sorry, if you could also tell me, you said you stimulate his arm. Maybe you could add in details on how you do that about stimulating his arm.
Sure. So Ian is one of the, he is so smart and so giving, and he's done so much for neurotechnology. It is risk to do anything new. The risk is getting more well known as years go by with brain computer interfaces, or deep brain stimulators is another example that's been around for a while. You could talk about pacemakers. They're risky in the beginning and we begin to learn more. So Ian has had his chip implanted in, specifically it's called the primary motor cortex. That's a fancy set of words for an area of the brain that lights up when you think of movement. So if I want to move my leg, this is mainly the part that becomes active, or my hand. So he's had the chip in his primary motor cortex for a little over 6 years now. He's been participating in the study, and along the way, it started with a simple ability to train his brain and open his hand again, which he hadn't been able to do before the device was implemented for a number of years. And I was not around during that time, but that's obviously a monstrous achievement that you could just open and close your hand. We kept going. The main progress, aside from having new movements, has really been in probably two or three domains. I'll explain. The first is, if we're going to have these neural technologies out in the community or in someone's home, the algorithms that decipher brain activity need to be stable, right? They need to kind of retrain themselves. If you think about a car that has all these sensors in it, maybe it tells you when you need your oil changed, and it can even schedule an oil change for you. That's really a nice feature that decreases user burden. So we've advanced a lot of the AI that's responsible for decoding these brain events. They're more stable, they're more robust to changes in brain activity, and they can even update themselves, which is really exciting. This is mainly using a field of AI called deep learning. So that's been one main thrust in development. You mentioned the arm. The original device that was used in the beginning of the study, big bulky electronics. I mean, it goes on the size of a dinner table, basically, all the stimulating and so forth. And the electrodes that go on the arm are lower profile, they're smaller. This is again the generation one, but they're a pain to put on and off, to clean. So what we've, in the second domain of progress, we've miniaturized all of the electronics down to the size of about a VHS tape. So it's been shrunk by over probably an order of magnitude. And now the electrodes that go on the arm are a sleeve, which looks just like a shirt fabric. And this gets zipped up around your arm, and it attaches to the miniaturized electronics. So it's more portable. It could potentially be used in the home. And the last, again, at a high level area of progress has been, it's nice to use this in the laboratory environment. Ian has to come into the clinic to do these experiments because has been a research grade tool that we're making smaller, faster, more reliable. But now we're making progress where, with these improvements, we can use the device at home. So this is the target goal, is to improve the quality of life, have hand movements not in the lab, but in your kitchen, in your living room. There's a lot of risks and challenges with this, but we're driving, and others are as well. So in closing, one of the most recent things that we've achieved is using this device in the home with Ian. I can't say too much about it, but that's been really exciting progress, and we'll be excited to share more details in the future on that.
Lovely. I wish you the very best for it, Patrick. I mean, it's exciting with the work that you and your team at Battelle are doing, and I'm sure it's going to help a lot of people, right? I mean, once it just moves out from your research facility and goes out to a wider audience, the healthcare industry all around the world. There's millions of people who have these terrible neuro injuries and they can't move and stuff like that. And we need people like you guys who can find a ray of hope for those kind of people, right? So tell me, I mean, that's invasive, right? I know at this point in time, it doesn't look like a possibility. Do you see a future where there could be non-invasive technology which could do the same thing what's happening at this point in time?
Good question. Very good question. I'll answer in two ways. So I mentioned the sleeve technology, which can be portable. It could go around an individual's maybe waistband. It could be zipped up and taken off easily. Um, Spinal cord injury is one application where you have upper limb dysfunction. Individuals that unfortunately have a stroke, or maybe even Parkinson's or some other upper limb disability, are potential users of this device. Again, that doesn't require surgery, so it's just the sleeve component. This can be used during rehab. It can be used, we've started to not only stimulate the arm muscles, but record from them. So this can be used to monitor limb activity. So that is one spin out that does not involve a brain-computer interface, where we can take one of those buckets, right, the end bucket, and use it non-invasively with other types of disabilities. The second way I'll answer is for a brain-computer interface, to have it be non-invasive or non-surgical, there is a lot of interesting work in that domain. Um, I am specifically working on a government contract right now with something called the Defense Advanced Research Projects Agency in the US. And we're working on a program called N3. So it stands for Next Generation Non-Surgical Neurotechnology. And in this case, it's very early, but instead of having penetrating electrodes, right, these are little pieces of metal that go into the brain. They may not last as long as you'd like. We are using nanoparticles, which are very, very, very tiny. Again, if you take out your hair, you can fit many of these across the width of a hair. We're using these. They have special electrical and magnetic properties. Still early, but this is our vision for this is to replace these electrodes in the brain with nanoparticles that can be put in. If they're magnetic, you can guide them around, and also they can be taken out. Magnetic nanoparticles have been used as a contrast image enhancement for individuals that are having imaging for tumor location and so forth. So there's some prior art there, but that's one way in which you could potentially get this to be non-invasive. That would be a dream of the brain-computer interface field, to have non-surgical interfacing with the brain that's high information content and reliable, that you can also record and stimulate. So that's kind of one of the goals of the N3 program. There's a lot of other good research in that area too.
Technology is growing exponentially, and nanotechnology, I think, could play a very big role in the future of brain-computer interface, right? But there is, the way that the technology is growing, there's another side which not many people are talking about, right? The moral and ethical implication of something like this, right? Do you see that the disabled who require this technology could end up having extra capabilities because of the technology? What I mean by that is, like, do you see them becoming the next mutant? Because just imagine about your neuroprosthetic limbs, right? Which is connected to your, now these are metal hands which are connected to your brain, right? And it gives you extra capabilities. Now there are so many, you heard being one of the leaders in the space who's got a neuroprosthetic limbs and stuff like that. There's so many others over there, right? So do you see that a technology like this giving additional capabilities which the rest of us don't have?
I think it's tricky because there's at least two things that come to mind. If let's just say we're interfacing with a computer, right, and we don't want to use our hands, we want to use our brain. This is something, I think Siri does this, or other voice controlled things. It's not really a neural interface, but um, you're going to be limited if you can tap into the brain, right? And let's just say in Ian's case, he thinks of a movement. Well, maybe you think of an email, right? And you don't even have to write it. It gets written 10 times as fast. Maybe that's an example of an enhancement. The systems that you interface with also have to be intelligent too. So if I get information, the algorithms have to be very good, and whatever I'm affecting has to be autonomous, right? The computer may have to know what an error looks like when you set things in motion. If the device or the computer that you're sending your thoughts to is subpar, then you're losing out on the whole arc of, okay, I'm recording from your brain, I'm using advanced algorithms to decipher it. If the end bucket is limited, then the overall functional enhancement is limited. Um, Cell phones are another example of this, where it's, you become more enhanced because you're more connected, but you're limited by your thumbs. So there's a lot of angles where you can maybe, it depends what you want for your enhancement, but I could thought to text in the future as a means by which to interact with electronics, a computer. If you get into memory, if you get into, like you mentioned, having more arms to do things, that gets complicated because memory and even language, right? If you're thinking of an email, how the brain thinks of that, what code it uses, that is quite a grand challenge. So those are some of the things that come to mind. I think it's possible, um, but it's a little far off. So we'll have to wait and see.
Yeah, definitely. So, but somehow I see that the way technology is growing, yes, I mean, maybe it could be 50 years, let's put 100 years, 200 years down the line, but the way things are growing, with the technology is growing, I'm sure it'll be a possibility, where these futurists say there could be a hive mind where we won't need to talk, we could just share our thoughts and things like that. So those are the positives. I mean, there could be a lot of moral and ethical implications arising or something like that. But do you see that this is like a closed loop, as in, it's interconnected? The more you understand a brain, that could actually also accelerate or research of artificial intelligence, and maybe it could go from artificial narrow intelligence to artificial general intelligence. Do you see that as a possibility?
Yeah, so if you look at deep learning, right, this is an algorithmic architecture that is in part inspired by the brain, right? You have little neurons in a network, you have connections between them. They're not really brain cells, but they've been modeled or constructed to maybe function like them. When you get AI to work, you've really made some sort of a mini brain, so to speak, right? You've made a new circuit made of neurons and connections. Um, the understanding of the brain can potentially, definitely, in a deep way, inspire AI and different hybrid architectures. It already is. So there are components of AI right now that have memory. Again, maybe in part inspired from neural function. They have hybrid deep learning architectures that can dream. So we need to practice things, right? We might do that in our dreams and add in noise to X, Y, and Z. So to have a closed loop understanding between how the brain works and how AI works, I think that's central to what's happening right now in AI. Specifically understanding, let's just robotics. There's a number of things to talk about. Robotics is one in which you have an agent that you want to interact with maybe a population of people. It goes out and it gets you a sandwich or something like that. To get to that goal, you have to be able to read people's body language, right? If you're a robot and you're going out X, Y, you have to be able to up and down the stairs. You have to be able to have memory about things. You have to be able to learn on the fly. So I think it's very intimate with whatever application you're looking at, that it's going to be inspired or borrowed from human behavior or human cognition, or even really how the brain is designed at a very small cellular level. So there's all different levels to where we can take the brain as a cheat sheet for sure.
Right. So can you talk a little bit more about your subject, Ian? Where where does this stand right now? Are you doing more research, or are you looking at other subjects at this point in time?
Right. So we're always trying to expand the use of the technology into more patients' lives to help more people, whether it's even just using the sleeve or using the brain computer interface. Um, so Ian is still engaged with us. We work with him on a weekly basis. Um, Specifically, the goal and one of the things that Ian has wanted for a while is to use this in the home. So that's, again, as I mentioned earlier, one of the main goals that we're driving towards, where he can use this even maybe in a telemedicine type of approach, where he's checking in via the internet to XYZ caretaker. Um, so that would be, I think, a fantastic achievement to get this eventually into very frequent use with Ian, and also using this in sorts of different clinics. Um, so Ian has been fantastic. He's been working with us, I believe, for coming up on 9 years or so, something like that. The other things that we've been working on with regards to the sleeve interface that we've built is recording the activity of the arm. So if you think about movement, you can happen in the brain, it can happen, it goes down to your spinal cord, and even there might be a little bit of movement signal left in muscles. And
Right.
so that is another thing that we're looking at, is instead of recording from the brain to get a signal of I want to move my hand, right? We can potentially record that event in the arm. It might be very weak in terms of leftover muscle activity. That's another way in which you can control something, is if you have a small amount of it left, you can record it, use AI to decode it, and then maybe stimulate the arm just by listening to the arm. It might be too weak to make the hand move, but you can boost it up. So that's another application that is non-invasive, as you mentioned, which is another approach that we're looking at, not just to have an invasive technology, but to have technologies that can give you function without surgery. So um, in the future, I hope that there's many, many patients using these types of devices, and there's a lot of this going on around the world now, where you can do a lot without surgery, which is it's a big deal, because you cannot have, it's hard to have a limited set of patients with some risk. We're always trying to make things better. Non-surgical neurotechnology is very exciting.
Right, right. You said you're super excited for doing what you're doing. So, what are you looking forward to? Because I know that there are these advances in the brain-computer interface with the kind of material that they're using. There are people who are talking about using graphene. There are people who are talking about using silk. There are nanotechnology and things like that. So, what are you most excited? What are you looking forward to?
So the materials interface, let's just say it's an implanted material, is a big deal. You could talk about stimulating a peripheral nerve. We do that at Battelle as well for therapeutics. If you're in the brain, you want things to last long. And then if you're on the surface of the skin, of course, you want things to be dry. You don't want to have, gel on to enable the interfacing with muscles to stimulate. So there's always improvement in materials domain. I think that nanotechnology can play a large role in a lot of this, where it is the norm to think about, okay, you're going to have a pacemaker, you're going to have a deep brain stimulator, you're going to have a brain computer interface. We're going to implant something that's metallic, right? Bulk material. Um, Another way to think about it could be that if you want to interface with the tissue, you don't have to have a piece of metal penetrating into the tissue or something else invasive. So I would say that neurotechnology and nanotechnology, again, I'm biased because this is one of the working on, has a bright future. That would be very intriguing to have an interface that you can inject. That's another means by which we would like to access more patients without having surgery. So I believe nanotechnology and AI are going to drive a lot of the changes and benefits of future neurotechnologies. Because even if you can interface well, you still have to decode well too. So there's a lot of cool challenges ahead.
Bioelectronics medicine also happens to be a part of your research. So, can you please explain to my audience what bioelectronics medicine is?
Bioelectronic medicine, similar to brain-computer interfaces, is new, and the goal is to enhance the quality of life of patients and treat disease. So if we think about a pill, right, an Advil, Tylenol, you name it, it's enabled a lot of great things from therapeutics for all different types of disorders. Let's just say you take a pill, you drink it with a sip of water. It would be really nice if you could shut the pill off or even turn it on only when you need it. It would be nice if the molecules in the pill, or the agents, only went to where they need to go in the body, right? Because they go all over when they're in the
Right.
bloodstream. So bioelectronic medicine tries to deal with two of those shortcomings of like pharmaceutical or molecular medicine, like a pill. And the way that we do that is, instead of taking a pill, we stimulate one of your peripheral nerves. So this is done for many nerves. One of the most common is the vagus nerve, and this is a nerve in your neck. It's connected to almost all of your organs. And the goal there, and what you get, is if you have, let's just say, a headache, for example, stimulating the nerve or nerves that can open up blood flow to your head or reduce pain, turning it on turning it off fast, now achievable. Also, because you're targeting only a specific part of your body, right? Nerves only go to certain branches of tissue and organs. You can be more selective, so you can target things in time, turn things on and off. And the general tagline of bioelectronic medicine is giving medicine with electricity, right, instead of pills. So that's something else I'm working on at Battelle, and I've worked on in the past.
Lovely, lovely. So, is there anything else that you would want to add and share with our audience about Battelle, and especially with you?
I would just say, kind of mentioned this during the conversation, the field of neurotechnology is very bright. Um, we work very hard to have the risks outlined to patients as well as the benefits. And the things that Ian has done for neurotechnology and the things that participants are doing to help co-develop this technology. If you think about tech, you can think about an engineer or a scientist, but the participants that are getting involved in research and communicating with them to make sure that it's being developed the way that meets their needs. There's this big continuum that's really exciting. So I'm just super enthralled for the future of neurotechnology, and it's been quite a ride so far. So we have a lot more work to do. But
Lovely, lovely. Patrick, really appreciate you taking time and talking to us and sharing your insights on how this works. What is the future of this technology? How it's going to help mankind? So thank you. Please keep on doing what you're doing. And I love the tagline of Battelle, that it can be done. And our show, the ethos of the show is that impossible is nothing, right? So keep doing what you're doing. Thank you for being part of Change Our Possible podcast. Sincerely appreciate. And to my listeners, if you like what you see in here, please press the subscribe button. And like always, I'm going to leave behind all the details of my guests, because this is about building a community, reaching out to each other, and building a better world that can, where we can help each other and grow the ecosystem. Thank you, Patrick. Really appreciate you being part of Change Our Possible.
okay, thanks for having me.